My name is Morgan Harrington. I am the National Coordinator of Programs here at the American Liver Foundation. Today, I am joined by Dr. Shah, who is a hepatologist at Grady Hospital with the Morehouse School of Medicine.
Hi, thank you so much for having me, Morgan, and the American Liver Foundation. It's truly a pleasure to be here and to help provide some information and updated information on COVID from a hepatology perspective. A little bit about me. I do currently practice at Grady Health in Atlanta, Georgia with Morehouse School of Medicine. But prior to that, I just completed my training in transplant at Cedars-Sinai, and then prior to that, my GI fellowship at UC Davis Medical Center.
Awesome. We're so happy to have you here today. And as you briefly mentioned, we're going to be going over some new updates for COVID-19 and just sort of going over new guidelines that are maybe in place since 2020. So COVID-19 has been with us for a few years now. From a liver health perspective, how has our response changed and evolved over time?
Sure. Thank you for the question. So, it has changed quite a bit since, the start of the pandemic. We've had a lot of new medications come out, vaccines, of that sort. And so I wanted to kind of take a moment to talk about what's changed with liver disease and what we understand about how COVID affects the liver. So let me just start with what research has come out with COVID itself, the infection itself, and its liver disease. The way that we're seeing COVID affect the liver is that it can cause inflammation of the liver directly from the virus itself through a protein that it enters into the liver. And so we do see some elevations in liver tests. That's at the very far minimum level. However, the severity of COVID can vary from individual to individual, and patients can become critically ill. And in that case, liver injury might be more severe. And so, it's kind of a broad spectrum of what we're seeing, a wide array. In addition to elevated liver tests, what I've seen personally is actually it can affect the bile ducts as well if somebody's had a severe COVID infection and cause what we call stricturing or tightening of the bile ducts. That may also happen over time as well with severity of COVID disease.
Wow, that's incredible to know. You had mentioned in there that there were new treatment options for COVID-19. While recognizing that all patients should discuss medications with their personal providers, are there any specific groups of liver patients who maybe should avoid these treatments?
Yes, I highly encourage anybody with chronic liver disease to discuss any new treatment medications that their primary care doctor or any other doctor or provider might offer for treatment of COVID, just due to the fact that we have some medications that may affect the liver directly. So, for example, remdesivir is known to cause elevations in liver tests, and so it might not be the best drug for everybody. The other particular group I wanted to highlight are patients that are post-liver transplant that are on immunosuppression medications, particular what we call calcineurin inhibitors like tacrolimus. There's a significant drug-drug interaction between tacrolimus and a medication called Paxlovid. And so I really don't recommend those two be taken together. I do recommend you let your transplant team know if you are going to be starting any medications for COVID.
Oh, that's so great. Thank you for sharing that. So, are all patients that are liver patients considered high risk when it comes to COVID-19, or what additional precautions should people be taking, maybe particularly during seasonal surges?
So some of the research that has come out has shown that COVID might actually accelerate some underlying liver disease and severity of liver disease. And so they might be considered, I consider my liver patients to be at increased risk for complications from COVID-19. And so what I really do recommend is that they take their precautions with masking, frequent hand washing, and avoiding stick contacts, which I know hasn't changed much from 2020, but it really is the best and most effective, in my opinion, for, reducing the risk of COVID.
Yeah, that makes sense. You had previously mentioned liver transplants in relationship to medication. So, what ongoing effects are we seeing with COVID-19 related to liver transplants? And can you explain sort of the current policies and guidelines regarding transplant procedures?
Sure. I think I really can't speak for each center. I think it's very center specific about the COVID protocols and what they are doing. I do know that there's risks to transplants with an active COVID infection, especially if you are having lung symptoms. And so that might delay surgeries for some patients. And so, it really depends. And again, it's all about making that great relationship with your treatment team and the transplant teams that you have. And I think open communication both ways really does help foster that relationship and help ameliorate any, concerns from the patient side.
Yeah, absolutely. Like you mentioned, always connecting with your provider is so important because each center is going to be a little bit different.
Right.
Related to that a little bit, so many people are concerned about COVID-19, especially long COVID right now. And you've mentioned a few times about, at the minimum, we're still seeing some inflammation and elevated liver enzymes. How might long COVID affect liver health in particular in both liver patients and maybe even healthy adults?
Right. So again, that's another really great question. It's a really a big area of research for some people, and so we're still finding that again, it might be accelerating some particular non-alcohol or metabolic associated steatotic liver disease. We might be seeing a little bit more progression, more prominence of that. The other effects of COVID, I think that we're seeing on a more social perspective, is actually a really stark rise and increase of alcohol use and alcohol-associated liver disease, especially in our younger populations. And so, I think for me, at least, what I've seen is that a lot of centers have actually become a lot more accepting of alcohol-associated liver disease and earlier transplants for these patients. I know some patients might have heard about a 6-month sobriety rule, but I could say far and wide, most centers have done away with that rule. And so again, it's just really important to have an open discussion about what you're experiencing with your provider.
Yeah. So along those same lines, you're saying that there's been this influx of alcohol-associated liver disease, but mental health is so crucial to our overall well-being. What advice would you give to patients who are still feeling anxious or maybe reluctant to attend medical appointments for fear of exposure or, too worried to come to see you?
Yeah, I think one of the other great pearls that have come out of the COVID pandemic, at least from a healthcare standpoint, is the wide use of telehealth visits, which I think has really helped me be able to access a lot more patients and a lot further away. But I think on the other side, I do think that there's some benefit to coming and seeing your provider in person. And I know a lot of us hepatologists have talked about that we do miss seeing our patients in person. So I really, I have seen a lot of patients suffer from anxiety and depression with the pandemic, and a lot of anxiety is developed around, there's a wide influx of information going around with COVID and what to believe, what not to believe, or what's truth and what's not. I think that's a really tough conversation to have and to find out for yourself. And so what I would do and recommend for any patient of mine or any patient out in the that's watching this video is really please do reach out to your provider and discuss these concerns. I can't emphasize it enough that I really do appreciate it whenever my patients actually do reach out to me and tell me what they're going through. Even as a hepatologist, I think it's important for me to know. And so I can figure out ways to help and support you.
That's so great. Again, I really appreciate you taking some time out of your day today to just jump in with us and sort of discuss a little bit further about just updates with COVID-19 and how it's related to liver health. So thank you again for being here with us. We really appreciate it.
Thank you for having me.